Hello, citizens of Internet. I am Dr. Ajit Virkud, Professor of Obstetrics and Gynecology and ex-Head of Department of Obstetrics and Gynecology from Mumbai, India. Today, I am going to discuss ultrasound signs of pregnancy failure in early pregnancy, a simplified ultrasound approach. Miscarriage isn't sudden. Its warning signs appear weeks earlier on ultrasound. When early pregnancy stops developing, the scan tells the story first. Intrauterine pregnancy failure can be diagnosed based on 4 definitive criteria. 2 are size-based and 2 are time-based. There are 8 suspicious criteria indicative of pregnancy failure. Suspicious criteria are also called intrauterine pregnancy failure of uncertain viability. Discriminatory crown lump length is the first definitive criteria for pregnancy failure. This is the crown lump length above which the absence of heart motion is unequivocal for failure. CRL of 7 milliliters or more without cardiac pulsations is a definitive criteria with 100% positive predictive value. As you can see on this image, there is an embryo measuring about 16 millimeters in crown rump length. However, there are no visible cardiac pulsations denoting definitive pregnancy failure. The second definitive criteria for pregnancy failure is a mean sac diameter of 25 millimeters or greater, accompanied by the absence of a visible embryo. This criterion exhibits a 100% positive predictive value. As depicted in the accompanying image, the mean sac diameter is approximately 27 millimeters and no discernible embryo is observed within the gestational sac. This observation unequivocally indicates definitive early pregnancy failure. Time-based definitive criteria are needed because discriminatory mean sac diameter or crown rump length may never be achieved. So these are absence of embryo with heartbeat 14 days or greater after a scan that showed a gestational sac without a yolk sac, or absence of embryo with heartbeat 11 days or greater after a scan that showed a gestational sac with a yolk sac. Next, I will discuss suspicious criteria for intrauterine pregnancy failure. The first suspicious criteria is a crown rump length less than 7 millimeters with no heart motion. Ideally, one should never see embryo without heart motion because the heart motion starts early even before you can see the embryo definitively. If you see an embryo without heart motion, that is suspicious for pregnancy failure. As you can see on this image, the crown rump length is 4 millimeters. However, there are no visible cardiac pulsations. In short, any embryo without heart motion is suspicious. The second suspicious criterion is a mean sac diameter of 16 to 24 millimeters and no visible embryo. As you can see on the image, the mean sac diameter is 22 millimeters. However, there is no visible embryo. This is suspicious for pregnancy failure and follow-up ultrasound study is highly recommended. Note that first and second criteria are slightly less than the discriminatory size diagnostic for failure. The third and fourth criterion are absence of embryo with heart motion seen up to 13 days after a scan which showed gestational sac without yolk sac, or absence of embryo with heart motion 7 to 10 days after a scan which showed gestational sac with a yolk sac. Note that the time intervals are slightly less than the time intervals required for definitive diagnosis of failure. The fifth suspicion criteria is empty amnion site. It is a sonographic visualization of the amnion adjacent to the yolk sac with no visible embryo. As you can see on this image, here is the amnion but embryo is absent. This implies pregnancy failure. A follow-up ultrasound scan after 1 to 2 weeks is indicated to confirm the suspicion. The sixth suspicion criteria is if the yolk sac is several millimeters or more, this is suspicious for pregnancy failure. As you can see on this image, the yolk sac measures about 8 millimeters. This is abnormally enlarged yolk sac and suspicious for pregnancy failure. A follow-up ultrasound scan after 1 to 2 weeks is indicated to confirm the suspicion. The 7th suspicious criteria is small gestational sac in relationship to size of the embryo. If the mean sac diameter minus crown rump length is less than 5 millimeters, this is abnormal, and sometimes this is called first trimester oligohydramnios. As you can see on this image, the mean sac diameter is 14 millimeters and crown rump length is 12 millimeters. The difference between the two measures is 2 millimeters. This is abnormal and suspicious for pregnancy failure, and follow-up ultrasound study is recommended. The 8th suspicious criteria is absence of embryo 6 weeks or more after the last normal menstrual period. So we can see here it is supposed to be 6 weeks and 5 days according to her last menstrual period, but there is no embryo seen. But caution should always be taken when using these criteria because a lot of women do not have regular cycles. So this sign should only be considered if there is a reliable menstrual history of regular cycles or if it is a pregnancy by assisted reproductive techniques. Take home message. Understanding the order of appearance in early pregnancy is essential for diagnosis of intrauterine pregnancy failure. There are 4 definitive criteria for intrauterine pregnancy failure. 2 are size-based and 2 are time-based. There are 8 suspicious diagnostic criteria for intrauterine pregnancy failure. They are absent cardiac activity by certain crown rump length, absent embryo by certain mean sac diameter, absent embryo by a certain point of time, abnormal morphology of the gestation sac, amnion and yolk sac. When there are findings suspicious for pregnancy failure, follow-up ultrasound at 7 to 10 days is generally appropriate. Using these milestones in sequence, dating errors are minimized and early pregnancy complications like missed abortion or ectopic pregnancy can be promptly identified. Early and precise dating is crucial for optimal prenatal care, intervention planning, and accurate screening for chromosomal anomalies during the nuchal translucency window. Serial ultrasound can track normal development, flag risk factors early, improving outcomes for mother and fetus. In conclusion, transvaginal ultrasound in early pregnancy unlocks a timeline of vital milestones guiding dating, viability, and management decisions for every expectant mother. For more evidence-based insights into obstetrics ultrasound, don't forget to subscribe to my channel. If you want to know more about this topic or any other topic in obstetrics and gynecology, please refer to my books Modern Gynecology, Modern Obstetrics, and Practical Obstetrics and Gynecology, and other books. For purchase inquiries, contact me on this WhatsApp number. I have also published 2 question answer books which are particularly useful for exam going students. These are Clinical Cases in Obstetrics, 1000 plus questions and answers, and Clinical Cases in Gynecology, 1000 plus questions and answers. You can also follow me on other social media platforms like Facebook or Meta, Blogspot, and Instagram. The links are given here. If you enjoyed this video, hit the like button, share it with your friends, and also subscribe to my channel for more videos like this. Thank you for watching.